At a suburban home, a teenager's bedroom is filled with small treasures. The 14-year-old was born a boy, but in Year 7 declared she was a girl. Her loving family didn't know where to begin.
We knew absolutely nothing about trans people, what it's like to be trans, how to support her, what is transitioning.
For another parent, a watershed moment came even earlier. Her child, who we're calling Carly, asked if she could change gender to a girl at the age of 8. In 2020, she was referred to the Queensland Children's Gender Service, where a team provides assessment and support.
It's been a long process. There's nothing fast about it.
5 years later, Carly was on the cusp of starting medication to block puberty when Queensland's health minister made a snap announcement.
An immediate pause.
A health directive banned doctors in the public system from starting young gender patients on puberty blockers or hormones pending a review. Those already prescribed the drugs are able to continue, but it's left more than 400 patients on the waiting list and others seeking treatment in limbo.
It meant that we could not get puberty blockers through the public system. So we have to go private, and that's expensive.
Tim Nichols announced an independent probe of the medical evidence for using the drugs. He cited restrictions overseas, issues with a service in Cairns, and a desire to safeguard children. But many parents are distressed and outraged.
They are lying when they say that they're concerned about the health and safety of my child, because they are not. It is ideology, and I've had enough of it.
We thought we were on track, that she could be who she wanted to be, and they just, pulled the rug out from under us.
Dr. Fiona Bishop has treated trans patients for more than 20 years. She's scathing of the statewide halt.
I think it's despicable. It was a decision that was made without any consultation with the community who are affected, without any consultation with the clinicians or the services providing that care.
The freeze has drawn broad concern from medical bodies to mental health and human rights commissioners. Brisbane's Anglican Archbishop adding his voice.
To pause what for many of these young people is a significant and important part of a much bigger treatment plan, I think ultimately may put some young people at risk.
But the government's move has some supporters, including an academic psychiatrist who says the current approach does not adequately consider whether mental health issues are a factor.
I think the evidence does suggest more that gender-affirming care is likely to harm kids than it is likely to help them, and I think that that's completely unethical.
That's disputed by those who work in the field.
The evidence is overwhelmingly in favour of gender-affirming care.
The Health Minister, Tim Nichols, hasn't responded to invitations to meet with those affected. In a statement, his office says all stakeholders are encouraged to take part in the review. He's yet to announce who'll lead it. The changes have galvanised the trans community. Many feel unsafe after Donald Trump's attacks on trans rights.
What do we do? Stand up, fight back!
Bet Benjamin is a support worker and radio presenter who transitioned in her 40s after decades of unhappiness.
I wish so much for trans kids that we could all find greater acceptance, and I don't want any child to ever have to go through what I went through.